Hi there, I'm Joe Ty, and this is a special message for my good friend Candace Smith and her colleagues at Lee Health. I am so much looking forward to my visit with you all in October. We're going to have a lot of fun. We're going to get a lot done. But for now, I want to wish the nurses of Lee Health a very happy Nurses Week. You know, it's been a long time, 3 years, since we've been able to get together in person and celebrate Nurses Week. And I hope you're able to have a great celebration this year. You know, I've been in healthcare for more than 40 years. I've worked with all sorts of organizations. I've worked with hospitals from Alaska to Florida, California to Maine. Worked with small, rural, critical access hospitals, big urban medical centers, for-profit, not-for-profit, VA medical centers. And the one thing that I see consistently over and over is the role of nurses, and that nurses are the heartbeat of healthcare. And we have never seen that heart beat more strongly and powerfully. We've never seen that heart be more challenged than we have in the past 3 years during this pandemic. I had a conversation with the chief nursing executive of one of the biggest hospitals in New York City, one of the hardest hit hospitals. She told me that military academy would have been better training, better preparation for what they were going through than nursing school was. But then she went on to talk about how proud she was of her nurses, of the courage and determination they had showed, of the compassion and empathy that they continued to share with their patients, even in this most challenging of times. To talk about the teamwork, the fellowship, the way her nurses supported each other. And to me, that captures the essence of why nursing really is the heartbeat of healthcare. Year after year after year, nursing is rated as the most trusted profession on the planet. And I think in the last 3 years, you have put a lock on that for the rest of the century. You know, we talk about this light at the end of the tunnel. And unfortunately, it's not going to be like running through the finish line of a marathon and it's over and now we can have Gatorade and go home. No, the light at the end of the tunnel is really a flickering torch. And it's our obligation to pick that torch up and carry it, because as we move ahead, there are a lot of people in the tunnel behind us, people who are going to be struggling physically, emotionally, including many of our colleagues. And we need to bring them along with us. And we know that there are tunnels ahead. And so that torch is to illuminate our way into whatever the challenges in front of us are. We know they're coming. But this week, this Nurses Week, I hope you will step back, take a deep breath, pat yourself on the back for what you've been through, for what you've contributed. Give each other a hug, because we need you. We're going to continue to need you. We need you to stay strong. We need you to stay strong for your colleagues, for your hospital, for the patients you serve, for your communities. We need you to stay strong for your family, for your friends. We need you to stay strong for yourself so that you can stay strong for us. So have a happy Nurses Week. I will see you all in October. Thank you for what you are doing, for your commitment to the welfare of all of us. Thank you for being the beating heart of healthcare.